Tonight, a new study shows more children are being diagnosed with ADHD. The CDC is calling it an expanding public health concern, but some doctors think it's the opposite. CBS 8's Alex Lai talked to a local doctor to find out more.
A new study found 1 in 9 kids have been diagnosed with ADHD. This is a big difference from data in the past, but some doctors actually see it as a good thing.
I don't view it as a bad at all. I think previously children were getting missed, and now we're actually able to help and identify children who have ADHD.
The study from the Centers of Disease Control and Prevention found 7.1 million kids ages 3 to 17 had an ADHD or attention deficit hyperactivity disorder diagnosis in 2022. That's 1 million more children than in 2016. But Rady Children's Hospital child psychiatrist Dr. Jenkins says that's because more people are coming in looking for a diagnosis.
And I think there's really 4 reasons why this is the case. One is there's increased awareness about ADHD. If you open your phone, you turn on social media, someone's talking about ADHD.
The other reasons are because stigma has gone down a lot, there's increased access to health professionals, and the diagnostic criteria for ADHD changed. She says classic symptoms of ADHD range from difficulty focusing, fidgeting, and impulsivity.
The signs of ADHD are much more visible in boys. You're going to notice a child who's hyperactive, who can't stay still, but someone who's more inattentive, who might be daydreaming, they're not going to be as visible and easy to be identified.
Previous data shows boys are diagnosed with ADHD far more than girls are. But the new study finds that difference is narrowing as doctors are identifying more symptoms in girls and women.
The best first place to start if you're worried that your child has ADHD is seeing your pediatrician. Pediatricians actually diagnose and treat probably the majority of ADHD.
And as far as treatment,
we really individualize it to that child and that family and look at the big picture of their whole life. What's happening at school, what's happening at home, what's happening with friendships.
That may mean medication, therapy, or extra help at school.
And usually the best treatment for children that are over the age of 6 is going to be a combination of therapy and medication. And for those under 6, we always start just with therapy first.
So it's not necessarily that more kids have ADHD, it's that more kids are getting diagnosed.
ADHD is a very treatable condition. There's so much hope. People are very, very successful with ADHD diagnoses. So being able to recognize it early and help children learn skills is more than I could ask for.
Alex Lai, CBS 8.